Nina from Megi.AI. Nina, the stage is yours.
Hello everyone, my name is Nina. I'm a CEO of Megi, and my family owns a cardiovascular clinic that's been, for the past 25 years, it's been providing cardiology and cardiovascular surgery to more than 20,000 patients each year. So while patients are with us, they are safe. But once patients leave the hospital, most of them are on their own. They are scared, and nearly half of them is not able to follow the treatment. And this leads to worse treatment outcomes and rise in preventable deaths. So our dream is to scale cardiology expertise and put it in the hands of every patient. So we took all the knowledge we had and a year-long experience in remote patient monitoring and data, and we've built an expert system that in a form of a virtual health assistant is available to patients 24/7. And we call her Megi. So Megi, she's very proactive. She speaks with patients on a daily basis, and using behavioral science tools, she ensures that they understand and that they're engaged in their treatment. She provides them ECG, blood pressure, therapy monitoring, and education. And her brain is a set of medical algorithms, and using AI, she can personalize monitoring program to each individual patient and their healthcare needs. And then at the back, it is a clinical decision support system that analyzes all the incoming data so doctor knows exactly who and when needs their attention. So with this approach, we've achieved 98% patient adherence. Patients are using it for months. And this automatically translates to increase in clinical efficiency, and yet identifying those patients for whom medical attention is critical. So this has been recognized by other healthcare providers, notably primary care physicians, and we launched 2 pilots with Bayer and Novartis. We are an interdisciplinary team that brings together medicine, behavioral science, technology, and business experience across healthcare industry. And we are looking for investors and partners who can support us in commercializing in Europe. Because scaling this concept and transforming hospitals to smart hospitals is not only saving lives, but is a tremendous opportunity for the whole industry. Thank you.
I'm curious, how do you integrate into clinical pathways, and how do you make sure that there's a feedback loop with the doctor? Because I know for them it's pretty relevant to see this kind of information. However, they also don't want to be reliable to monitor their patients all the time.
Yes, exactly. So this is why we are turning into a B2B business model, so they're directly selling to hospitals. Then of course the system needs to integrate with their hospital information system. So basically the backend of our dashboard will be accessible from the hospital system. And when you say nobody wants to monitor, you don't have enough human power to be there 24/7 online, and this is where this analytics comes into play and why this is important. So basically they log in early in the morning and they see the dashboard with patients that day. But the system alerts them who needs their attention. So they don't need to basically sit there and they do it with manually. This is why the analytics is important.
Yeah. Then you're not integrated yet, but you're planning to be, and...
Yes, we are not yet integrated. We are now 6 months, so the technology is still in, let's say, in bits and pieces, but we have the concept validated. We are validated by the market, by patients. So this is why we are fundraising to kind of consolidate the technical parts so that this can scale further.
And then maybe one follow-up question in terms of medical evidence. What do you have to show, and how far along are you with any potential trials?
So far we've been monitoring high blood pressure, So what we can show is that with this kind of system, we are able to diagnose patients much sooner. So the process that in a current clinical setting will take up to 6 months, we are able to roll out the whole clinical, let's say, patient journey within 3 to 4 weeks, which is significantly shorter. Then we have data on how much the time required to gather information from patients shortened from 14 minutes to 5 minutes during a regular patient cardiologist consultation. I mean, we have plenty of such evidence, but we are, on an ongoing basis, we really keep track on all the KPIs.
Thank you.
Just a quick one. You just mentioned you only recently pivoted to this B2B focus, and is that true? That you now heavily target the hospitals, and before that, did you start as a consumer app, or what was your initial decision, and what was the learning about now going all in on the B2B side? Can you
I
share a bit
wouldn't
of?
say we recently pivoted, but we are the reason we are focusing in a B2B is because patients, they trust their doctor.
Mm-hmm.
And knowing that how healthcare industry works, I mean, there are plenty of apps and, let's say, monitoring devices available on the market, but somehow, there is a lack of also clinical validation of many of those technologies. So there is, in a way, the medical community doesn't even like when patients come themselves to a doctor and they say, oh, I found this cool app and I'm monitoring my health. So you need to have a buy-in from the doctor. He needs to trust your technology. And then when he offers that to a patient, they will use it because they trust their doctor. So in the healthcare industry, it's all about building trust.
Yeah. And that's not just something that's not a hypothesis, this is what you found out by first trying the other way. That's right, right? Yeah.
Awesome. Thank you so much, Nina. Great
Thank
pitch.
you.
Good. Those were the first 9 pitches of the pitch competition finals. The next 6 ones are gonna continue after the lunch break. We're now gonna make like 50 minutes break, and around 2 p.m. we all meet here again to watch the 6 other pitches. So see you all again. Have a nice break. Thank you.